and we'll move to Deepak Panigrahi, and the title of his presentation is Inflammation Resolution, a dual-pronged approach to mitigating cytokine storms in COVID-19 and cancer, ? So Deepak, take it away.
Thank you, Charlie. It's an honor to be part of this amazing session and to be sandwiched between Dr. Levy and Dr. Zeldin. It's been our experience, and Dr. Levy set an amazing and elegant presentation, set the foundation of what the cytokine storm is and the biology and the mechanism. Our lab has been studying the cytokine storm from a cancer perspective, and I think by the end of the presentation, you'll be able to see some of the lessons we've learned in cancer may apply to COVID-19 and other inflammation diseases that have been driven by a failure of resolution. Our lab and others in the cancer field have been focused in on the diet and control of inflammation resolution via the diet. If you feed mice with a 10% soybean high omega-6 diet, low omega-3 diet, you get a lot of metastasis. This is from arachidonic acid omega-6, and this can disrupt resolution and stimulate cancer in general. In contrast, if you feed mice a 10% Manhattan diet, a high omega-3 fatty acid diet, this can inhibit metastasis in mice, and we'll go into some of the mechanisms. And omega-3 derived resolvins, protectins, mauricins stimulate the resolution of inflammation and promote resolution and inhibit cancer. If you go back years ago, centuries, many years ago, the approach to inflammation, not only in cancer, but in general, has been to block only pro-inflammatory factors or pro-angiogenic factors. And the approach has many side effects also, whether it's steroids, which are immunosuppressive, they can impair wound healing, cause osteoporosis. Non-steroidal anti-inflammatory drugs cause stomach bleeding, kidney toxicity, heart problems. The COX-2 cyclooxygenase inhibitors, while in preclinical models were effective, they had a side effect of increased thrombosis, heart attack, and in cancer trials haven't worked. The biologics have been focused on blocking specific cytokines, such as anti-TNF, but this has the problem of increasing infections, dampening immunity, increasing risk of cancer, and also we'll get into in cancer trials, blocking a single pro-inflammatory factor has not worked, has failed. And suppression of NF-kappa B, which was a prominent target in the cancer field, has been shown to promote cancer. Going back to the history of inflammation resolution, Scottish surgeon John Hunter in the 1790s, he had stated inflammation in itself is not to be considered as a disease. And then the American surgeon, William Coley, followed up on this concept, and he actually treated sarcomas and bone tumors with bacterial mixtures, leading to tumor regression. And at the time, this was one of the only approaches to cancer therapy. And even though he was ridiculed during his time, he is considered by many as the father of modern immunotherapy. And then in the year 2000, Dr. Serhan asked the question, what turns inflammation off? What are the stop signals? The approach to the eicosanoids and the bioactive lipids in the cancer world has been to block prostaglandins and leukotrienes and pro-tumorigenic factors. And Dr. Serhan took a reverse approach and asked, what are the natural stop signals in the body that turn off inflammation, stimulate the resolution of inflammation? And this is a quote from his FASTA publication. It is time to challenge current treatment practices, namely using inhibitors and antagonists alone, and to develop immunoresolvins as agonists of resolution pharmacology. So this is an entirely different approach to not blocking pro-inflammatory, pro-angiogenic, pro-tumorigenic factors. And the specialized pro-resolving mediators are derived from omega-3 fatty acids. You can see the E-series resolvins are derived from EPA, the D-series resolvins from DHA, and the merisins are macrophage derived and are derived from DHA. So SPMs, specialized pro-resolving mediators, are not only anti-inflammatory, but they stimulate the resolution of inflammation. So they're dual-pronged. They're anti-inflammatory. They block leukocyte neutrophil recruitment, and they counter-regulate a series of cytokine and chemokine production. And this was really exciting to us in the cancer world, where tumors can generate multiple cytokines. And SPMs also stimulate macrophage phagocytosis of debris, and I'll get into how this was relevant in the cancer world. But the clearance of debris is a unique function of SPMs that anti-inflammatory drugs and other anti-cancer drugs do not perform. So the discovery of Resolvins, the resolution phase interaction products, were done in a mouse dorsal skin air pouch assay, in which the exudates were analyzed for LC-MS analysis. And now there are over 6,000 publications with specialized pro-resolving mediators between the lipoxins, the resolvins, merisins, and the protectins. So it's a very exciting field that was founded by Professor Serhan. So getting to the cytokine storm, these are all in animal models. And you can see here, these are all different models. Some will be related to COVID-19, such as ventilator-induced lung injury. And Bruce Levy had talked about ARDS and thrombosis. And other inflammatory diseases, pancreatitis, infection, diabetes, asthma, are characterized by a series of cytokine storms, whether they're in vitro or in vivo. How this is relevant to cancer is that cancer therapy creates apoptotic tumor cell debris. Surgery, chemotherapy, radiation. This is based on an old phenomenon. In 1956, Laszlo Revesz had a Nature publication that radiation generates debris that's through pro-inflammatory cytokines. And even targeted therapies such as immunotherapy, anti-angiogenic therapies can also create debris indirectly and stimulate tumor growth via inflammation. So this is one of the problems in cancer therapy and why the tumor can come back. In fact, generation of tumor cell debris may explain an inherent limit to chemotherapy, targeted therapy, and any cancer therapy that is cytotoxic. And stimulating the clearance of the debris is a novel approach to prevent tumor growth and recurrence. So I'll just give one example in ovarian cancer as an example of a cancer with multiple cytokines. And you can see multiple publications, interleukin-6, interleukin-8, MCP1, CCL2. These are each potently pro-tumorigenic. And clinical trials that focus on blocking individual cytokines, such as TNF-alpha here, have failed. And this is consistent with all the other tumor types. So targeting a single cytokine does not seem to work in cancer. So as a different approach in preclinical cancer models, we use stimulation of resolution inflammation to prevent the cytokine storm. And this recent publication, we focused on liver cancer and using the approach of resolution of the eicosanoid cytokine storm. Eicosanoids are lipid mediators upstream of the cytokines, such as prostaglandins and leukotrienes, and they can drive the cytokine storm. And in this publication, JCI, we gave Resolvins right before surgery at the time of chemotherapy, and we could eradicate in a subset of mice the micrometastases that will get worsened with surgery and chemotherapy and radiation. And in this aspirin-triggered pro-resolving mediators, such as ATLXA4, aspirin-triggered resolvins, they can stimulate the resolution of inflammation. This was done in lung cancer. And in this publication here, we did a similar approach with ovarian cancer. So what's exciting is that the resolution inflammation applies to many tumor types by preventing the cytokine storm and stimulating the clearance of debris that is caused by chemotherapy, radiation, surgery, and even biopsies. These are very common cancer tools that unfortunately will induce inflammation. And this is just an example of one of the experiments. So if you take chemotherapy-generated debris, this is the cell death that the cisplatinum cause. You can see debris alone doesn't cause any tumor growth. But if you inject a low number of tumor cells, in this case 10,000 tumor cells, normally you would inject 1 million to get a growing tumor, and then you co-inject with the chemotherapy-generated debris, you get a dose-dependent increase of tumor growth. And this is the Revesz phenomenon, except that was for radiation. We've adapted it to chemotherapy. So the mechanism of how the debris can stimulate tumor growth, as Dr. Levy had mentioned previously, the macrophages, when exposed to cell death or debris, can stimulate a cytokine storm. So you see on the left, the macrophages alone. This is a cytokine array. And then when you add debris from whether it's chemotherapy, radiation, or targeted therapy, cetuximab, or any cancer therapy that kills cells and is cytotoxic, you get this cytokine storm. So in this one slide, you can even understand why in cancer, a single cytokine neutralizing antibody such as IL-6 will not likely work. And even VEGF, Avastin, which blocks one of the potent pro-angiogenic factors, eventually doesn't work in cancer patients. And this is just to show the debris is also can come from non-tumor cells. If you see here, chemotherapy-generated dead cells, on the left is the macrophages alone. You see few cytokines, but when you generate the debris from tumor cells, whether it's Lewis lung or non-tumor cells, melanocytes, fibroblasts, or even primary fibroblasts, we want to see was this, an artifact of cell lines, but actually if you do primary cells, you generate the debris and the cytokine storm. And in fact, phosphatidylserine, which is an apoptotic signal, can also stimulate chemokines and cytokines. So apoptosis, which is the goal in cancer therapy, can paradoxically be a double-edged sword. And this also occurs in vivo. This is plasma from mice who have a debris-stimulated tumor, and you can see 9 or 10 different pro-tumorigenic cytokines from the plasma compared to non-debris tumors. So we depleted individually cytokines in these mouse models, and we saw that if you deplete just as CCL4 or IL-6, eventually the tumors escape pretty quickly. We would have to deplete about 4 different cytokines in a tumor experiment, and this is very expensive, about an $8,000 experiment. And then what we were very excited, instead of doing an $80,000 experiment and depleting 4 cytokines, if we treated with Resolvins, 1 dose, and this is nanogram per day, we could suppress the tumor growth by preventing the cytokine storm. So in this experiment, you can see the pancreas tumors grow subcutaneously. They're stimulated with debris, and chemotherapy at grams per day. You can see the pictures here. The dexamethasone, celecoxib, which was also at grams per day, were less effective. And the Resolvins at nanogram per day could keep the tumors small for about 4 weeks. And here you can see the cell debris from endothelial cells, epithelial cells, raw macrophages. You get this cytokine storm. And if you give RVD4 treatment, you can prevent a subset of cytokines. In comparison, if you give celecoxib, a COX-2 inhibitor, you can see very little effect on the cytokines. In fact, COX-2 inhibition can be resolution toxic, as Bruce Levy and Charlie showed in a classic publication that that prostaglandins are key for eicosanoid class switching from the prostaglandins to the SPMs. And so paradoxically, blocking a PGE2, which many cancer drugs try to do, can impair resolution of inflammation. In contrast, Resolvin D5, the Mericin conjugate, MCTR1, and MCTR2, you see a nice inhibition of the cytokine storm. And this is just with human macrophages, just to show it wasn't specific to mouse. You can expose human monocyte-derived macrophages to Resolvins either alone without debris, or when you add the debris, here you can see in the black, you get an increase in IL-8, TNF-alpha, CCL4, CCL5, and Resolvin D1 or D2 could counter-regulate the series of cytokines and chemokines. So as biomarkers, which in the cancer world and other inflammatory driven diseases, it's very important to have biomarkers. And you can see here some of these cystic fibrosis with Bruce Levy and his group, asthma also, and then sepsis, where Charlie Serhan had showed in his lab. These increased ratios of RVD1 and PD1, paradoxically, the SPMs can actually increase when there's severe sepsis, which is what we see also in severe cancer. And in certain diseases, you have a decreased resolvin to eicosanoid, for example, LTB ratio in atherosclerosis and carotid intima, decreased intimal thickness. So COVID-19, as Dr. Levy had shown in the previous talk, is characterized by hyperinflation and a cytokine storm. And if you induce the SARS virus into the macrophages, you get a whole series of these cytokines, and which are very, as we mentioned, pro-tumorigenic, pro-inflammatory, pro-angiogenic. And in the laboratory, in the clinic, you can use ferritin, C-reactive protein, interleukin-6 to measure the inflammation in some of these patients. So what we were interested in is comparing COVID-19 to cancer, and here you can see an overlap between some of the key cytokines between COVID-19 and cancer. And that's where we were excited that perhaps some of the approaches that we've used in cancer may apply to COVID-19. Furthermore, the SPMs exhibit direct antiviral activity. In this Cell publication, the protectin D1 had direct antiviral activity in severe influenza. In this model, they gave the influenza, and then 48 hours later, the protectin D1 was given, and it improved the severe influenza. In contrast, direct anti-vaccine drugs had no effect in this model when they waited 48 hours to treat. And you can see here the 17-HDA and SPM can also enhance antibody-mediated response against influenza virus. And this wasn't just specific to influenza. You can see here the herpes simplex virus, aspirin-triggered resolvins could improve that pathology. And influenza, you saw there was a loss of protectin D1. So here was also, similar to Dr. Zeldin's New England Journal editorial, the question was the time to target the host with these SPMs. What's also interesting is COVID-19 promotes angiogenesis, promotes fibrosis, promotes blood clotting in different organs, different tissues. And so resolvins are pro-resolving, they clear debris. They're anti-fibrotic, which is also important in cancer, for example, pancreatic cancer. They're anti-angiogenic. As we know, tumor growth is angiogenesis dependent. Anti-inflammatory, they improve pain. The resolvins can prevent blood clots. This was a recent blood publication with resolvin D4, attenuates pathological thrombosis in a mouse model. Importantly, and this is very important in the cancer world, they're not immunosuppressive. The last thing you want to do is give a cancer patient an immunosuppressive drug. And a recent Science Advances publication from the Serhan lab showed that resolution metabolomes are activated in the hypoxic environment, and resolvins can stimulate efferocytosis in senescent red blood cells in hypoxia. And this is also very relevant to COVID. And from the cancer world, I don't know of any cancer drugs that are anti-cancer and stimulate wound repair and tissue regeneration. So this approach is very unique in cancer in that it's directly anti-cancer and stimulates tissue wound repair and regeneration. And I won't go into it, but the stimulation of muscle regeneration with resolvins and MCTRs is directly relevant to cancer cachexia, which is a big problem in certain cancer types like pancreatic cancer. So this is really, with all of these incredible attributes, resolvins and the SPMs are a possible new link to COVID-19 and cancer treatment. And Dr. Levy had showed this kind of schematic from a commentary we had written, and really it was based on our cancer experience, that cellular debris, cell death can stimulate macrophages, at least in the cancer world, and we were hypothesizing in lungs. And this is through an eicosanoid storm, which we've shown in several publications now. And this pro-inflammatory eicosanoid and cytokine storm can also occur through neutrophils and B cells and T cells, which also express the SPM receptors. What's interesting too, and Dr. Zeldin with David Gilroy's group has shown that EETs can stimulate SPM production, which also Dr. Levy has shown. So a loss in EETs can also impair resolution. So another approach has been to give soluble epoxide hydrolase inhibitors to increase your EATs, and which will increase your SPMs. Several of these publications, Dr. Levy nicely explained, and several of these, and these are just in the past year, a couple that I picked up. So you can see inflammation resolution is highly relevant to COVID-19. This lipid storm in the COVID-19 patients was high prostaglandin E2, thromboxane B4, lipoxygenase-derived LTB4, and the SPMs were also involved with resolvins of the D series, lipoxygenase A4. And this editorial from Charlie with dexamethasone was based on their earlier studies that dexamethasone actually can stimulate resolvins of the D series and 17-HDA and lipoxygenase A4. And we actually showed in our cancer models that dexamethasone also can clear debris, but we're at much higher doses than resolvins. And this nice publication from Mario Romano's group, Dr. Levy had mentioned that the resolvins basically can counter-regulate the cytokine storm in COVID-exposed macrophages that were derived from cystic fibrosis patients. And this was a publication from Nicholas Bazan's group where they showed that the SPMs could reduce cornea injury. Here you see the ACE2 expression, and lipoxygenase 4 and resolvin D6 could reduce the ACE2 expression in contrast to the protectin D1. And you can see here also injury that was induced in the cornea was reduced by lipoxygenase 4. So in clinical trials right now, the resolvins are in clinical development for eczema, dry eye disease, periodontal disease, protectins for neurodegenerative disease, and lipoxins for gingivitis, eczema. And we're working with Charlie with another group at Thetis to put SPMs into clinical cancer trials for in the next 2 years. And so just to summarize, our study suggests that resolution inflammation is a novel treatment approach to inhibit cancer and COVID-19 via blocking the cytokine storm, and as well as clearance of debris and other pro-resolution mechanisms. And this is our lab now. This is Victoria Heisen-June, just left to return to China, and Fran Kipper is a postdoc, just joined our lab. And happy to take any questions if there's time or after all the 3 speakers.
Thank you, Deepak, for that really fantastic tour de force presentation. I just will quickly ask you, you and Bruce put an emphasis on the debris clearing aspect of the macrophage function. Do you know of any other agents that are produced endogenously that stimulate debris clearance, so that stimulate those macrophages to clear debris like an alveolar?
Yeah, in the cancer world, the only approach of increasing macrophage phagocytosis I know of is anti-CD47 antibodies, and resolvins CD47 neutralizing antibodies, Gabby showed can increase resolvins.
Right, yeah. So there's nothing as of yet out there, and I guess as we move to the panel discussion, both Dr. Calder and Bassinet will help us think about the right amount of precursor to take in order to boost endogenous levels, which is really a critical component. So thank you very much, Deepak, and we'll come back to more questions during the panel discussion. It was really a fantastic presentation.